So I'm on hormone replacement therapy and I still have a period or I'm spotting. Hello, this is Dr. Margie Egan, and this is my medical opinion only, not medical advice. This is a multi-level question, so I'm going to try and break it down. Common reasons for having spotting on hormone replacement therapy is you missed a dose. You forgot to change your patch. The big thing is missing doses of prometrium, of progesterone. If you've missed a dose for a day or two, you actually can have spotting. So that's why we say give it a few months to see if that occurs, and you can take a record and make sure that you're consistent with your dosing. So people on estrogen only patches, Dottie or Vivell, if they are not also on progesterone, such as prometrium, which would be a tablet, after being on the patch for 3 to 6 months, you should no longer have a period or spotting. So while you're adjusting to hormone replacement therapy, in those first 3 to 6 months, if you have spotting or a period, it's okay because your body's adjusting. After 6 months, you really need to talk to your physician and ask them what could be going on. Estrogen only patches always should be used with progesterone if you have a uterus. If you've had a hysterectomy or don't have a uterus for some other reason, can be on the estrogen only patch. So taking hormone replacement therapy, why would I ever do that? That is in women who are menopausal, meaning that they've stopped their period, they've been evaluated by the physician, and the benefits of hormone replacement therapy are well more than the risks and the side effects. There are many ways to take hormone replacement therapy. What I usually recommend, my opinion, is I like the patches, the estrogen only patches, Vivell, Dottie, there's generic brands. You take a patch, you usually do it 2 times per week, and then you also take progesterone tablet at night. This is if you have a uterus. If you do not have a uterus, you do not need the progesterone. You just need the estrogen patch. When you are first placed on hormone replacement therapy, and by that I mean the estrogen patches and the progesterone, your body needs time to adjust. And so you can have spotting or a period for those first 3 to 6 months. After that, though, if you have bleeding, you need to talk to your physician to see what else might be going on. Other reasons we might be concerned in people who have spotting are those menopausal women not on any hormones, and they've stopped their period, but then all of a sudden they have some bleeding. Those people should definitely go in to be evaluated by their doctor. I can tell you, I'm 61. I'm on the Vivell dot or the generic, whichever the mail order pharmacy likes to send me, and also prometrium. I've been on it since late 40s, since I went through early menopause. And I started to have some bleeding this year, just spotting this year. Once it occurs 3 different times, that's when it should alert you to go into your physician. So I did call my physician, who referred me to an OB-GYN, and I needed to have a pelvic ultrasound, which seemed to be okay. They didn't find anything. And the pelvic ultrasound, for those who have not had it, they have to do a probe into the vagina. So it's a little odd, but they can see all in the uterus and what's going on, how thick the lining is. And mine was just on the upper edge of normal. So that made them want to do an endometrial biopsy, which is what it sounds like. They have to go into the uterus and get a blind biopsy of the uterine wall. Mine came back and it seemed like it was fine, but the bleeding continued. So then they had to have me in the OR, where they were able to do then a biopsy where they could actually see where they were going. And there's a medical term for it, but I'm not an OB-GYN, so I forget the name. And that came back that I had a tiny little polyp that was benign and there was nothing to worry about. And so they dropped my estrogen dose a little bit, kept me on the progesterone, and I've been doing fine. So that's just to say, you can be on hormone replacement therapy for years and then all of a sudden have some issues. Just talk to your physician.